Well, let's turn our attention now to Africa's G20 presidency. Now, the country has said that its G20 presidency will focus on solidarity, equality, and sustainability. Well, when it comes to health, the country says universal health coverage will be at the center of its plan, and its health agenda will highlight the need for equitable multilateral solutions to address the health challenges of the 21st century. Now, next week, South Africa will host the second G20 Health Working Group as part of a series of countrywide G20 events taking place throughout this year. They'll be addressing various critical issues such as financial protections for universal health coverage and also sustaining health financing in a challenging global economy. Well, let's find out more about the discussions that are set to take place. We're now joined by Dr. Anshu Barnejee, the director at the Department of Maternal, Newborn, Child and Adolescent Health, as well as Aging at the World Health Organization. Doctor, great to have you with us on the show today. Now, of course, the main gist of next week's discussions seem to be about meeting those financing targets for organizations who particularly support women, children, and adolescent health. What do you expect will be the critical issues on the table?
Thank you very much, and it's a pleasure to be here with you. I think what we've seen in the last couple of months is that there has been a reduction in development assistance for health from, let's say, the global partners towards the beneficiary partners. And so this is going to be really important to discuss. We've seen that many countries have had to put emergency measures in place to ensure that life-saving drugs are going to be available for their populations. Drugs that were initially funded, let's say, by global partners. And so looking forward, it's going to be important to see, for example, whether countries will still be able to get their immunizations in place, whether drugs for tuberculosis treatment or for HIV treatment or for malaria will be still available in sufficient quantities for countries to be able to meet the population needs in these areas.
And like you sort of alluded to, we live in a more uncertain world today with U.S. aid out of the picture. So I'm curious to know what outcomes you are expecting in terms of how the group will be able to carve out a new financing agenda, especially for women's, children's and adolescents' health.
I think it's going to be very important to look at how countries can raise their domestic resources and increase the resources that they have through, for example, partnerships with private sector in order to fill the gaps that are most likely going to appear. But at the same time, also to have those discussions with the global partners to see how they can continue to keep on funding at the same rate as they have been doing. We've heard a couple of countries have said that they will reduce most likely the development assistance to health in relation to what is happening with the global economy, etc. But it's going to be important to have that bilateral discussion between the higher and the middle-low income or the middle-income countries in order to ensure that there is going to be, that from a global public health perspective, we will be able to continue to support these populations for the vulnerable populations such as women, children, and adolescents.
All right. Now, South Africa has said that its G20 health agenda will be focused on universal health coverage. But what is the WHO's position on the state of universal health care today? What do you think are the priorities when it comes to this?
So last year we came out with what we call a global monitoring report that highlighted that around 4.5 billion people are not fully covered by essential health services. So even here we're talking about essential health services, and that 2 billion people face financial hardship. And at the same time, we've also seen that around 344 million people globally have been in extreme hardship, in extreme poverty, and were pushed, let's say, because of not having the financial protection, and so having to pay for healthcare, that they were pushed into extreme poverty. So universal health coverage, fully financed for essential healthcare, is going to be crucial. It's WHO's policy to support countries in trying to achieve this and to work towards universal health coverage. And I think that, the services that are provided for women, children, and adolescents' health are part of universal health coverage. Almost all countries see this as their top priority, particularly in the low-income countries, to ensure that women, children, and adolescents can get the services that they need and that they are protected financially from potential hardship.
Now, you mentioned that universal healthcare is an issue for most countries, especially least developed nations. But of course, this is the first time the G20 discussions are being held in Africa. What is your take on the specific issues that are particularly relevant to the continent and, of course, the role that the G20 can play in addressing them?
So we know that maternal and child mortality is still very high in Africa and sub-Saharan Africa. We know that around 60 countries are off track to achieve the Sustainable Development Goals for maternal, newborn, and child mortality. So this is an agenda that's going to be very relevant for the African continent. And I think here, looking at the G20 countries, it's important to see how, in partnership, let's say, between the higher and the middle income countries, we can see how to address that. So again, vulnerable populations, we also know that investments for maternal and child health have reduced, investments for reproductive health have reduced. We have high teenage pregnancy still in the continent. We have high levels of unplanned pregnancies, and also still a high level of unsafe abortions that happen with around 23,000 women dying every year due to unsafe abortions. So there are many different issues that need to be looked into, need to be addressed, and we really look forward to those discussions to see how this agenda can be moved forward.
Well, Dr. Barnejee, thank you so much for those great insights. We'll certainly be looking out for the outcome of those discussions. That, of course, is Dr. Anshu Barnejee from the WHO joining us there.